Hi guys, my name is Mary. I've been suffering with CVS, cyclic vomiting syndrome, for 12 years, ever since I was a sophomore in high school. I've had I've had three CAT scans, and I've had four scopes, both oral and unfortunately anal. That's pretty much where they stick a tube all the way through your intestines with a camera and see what's going on inside your body. First, I want to tell you a little bit on what CVS is. It is a digestive disease that pretty much causes you to throw up and compulse daily, multiple times a day, and pretty much you can put yourself in the hospital from exhaustion and dehydration and weight loss and starvation. It's very serious and devastating. In my case, I would throw up 16 to 30 times a day. I would lose 15 pounds within 8 days. And I am currently 8 weeks pregnant, and I just got over a 2-year long break. I was very blessed, and this is the first time that the father of my child has seen one of my flare-ups since we've been together. He always said it was the boogeyman, something I always warned him about, but something he's never seen. Well, now he knows, and we were concerned about the health and well-being of my unborn child. If I would have had this flare-up when I was pregnant with my daughter, she's 5 months old now, she wouldn't have made it. My doctors said, because, let me back up a second. When I was going through all this, I racked up $90,000 in medical bills, with no answers, none whatsoever. And CVS is a very common thing. Doctors know about it, and it's like something that they don't ever think to suggest. Like, they just want you to keep coming back. I don't know what it is, but it's very common. If you look it up online, the definition's right there. It's in all the medical books. I don't know why this isn't one of the first things that goes through a doctor's head when you tell them your symptoms, but it's not. So $90,000 later, all the doctors just said that I was crazy, and they committed me to a mental hospital where I had an amazing doctor, Dr. Gilchrist. He was with Valley Healthcare. He prescribed me a life-saving drug that was an anti-anxiety called hydroxyzine, and voila, it was almost like a cure-all. The sickness slowly went away, and it really helped control my flares. This is what it looks like. I've been on this medication for a very, very long time. Now, one of the main causes of CVS is hormone imbalances, and there's some other causes that if you look it up online that you will see. That's one that I believe personally causes mine. Everything about me is opposite. When I'm on my period, my face is clear. When I'm pregnant, my face is clear. And normal women, these are times when they would break out. And all the time in between, I'm constantly broken out with severe acne. So that kind of is a red flag that something's not right with my body, but we don't know what. But it is a digestive disease, and the problem is there is a bad connection between your digestive system and your brain. Whatever is going on with you if you have CVS, it is causing you anxiety. The stress of the illness is causing you anxiety. So I would suggest going to see a mental health doctor and getting some kind of anti-anxiety medication, because it may just help stop what's going on. CVS is caused by triggers, such as for me, when I was all through high school, I had a huge flare all through high school for 4 years. I threw up every single day for 4 years. My teeth have been severely damaged, the enamel's completely gone, and they are yellow, and I don't smoke cigarettes or anything. My teeth constantly chip from all the damage. So there is a lot of anxiety involved, and that's something that you need to talk to your doctor about, because it could possibly stop your flares or control them. It's not a cure, but it's the next best thing. If you can't find out what's causing it, And I find that the anti-anxiety medication makes it like impossible for my organs to do whatever it does to force everything up and dry heave and be that way. I want to keep it kind of short, but because I became pregnant and the anti-anxiety is low fetal risk, my OBGYN, he didn't like it. He didn't like the anti-anxiety, so he took me off of it and gave me a $400 morning sickness medication that's supposed to be the real deal for nausea and whatnot. It had no effect, and it immediately, as soon as I got off my hydroxyzines, the flare came. I lost 15 pounds within 8 days, and the doctor was so afraid that I was going to miscarry that he put me back on my hydroxyzines. Unfortunately, because of this, I have to go all the way to Miami and get special blood tests done just to make sure everything is okay between the hydroxyzines and the baby. It's a pretty complicated situation, but if you're not pregnant and you're having a flare, I highly suggest you go to a mental health clinic and talk to your doctor about getting an anti-anxiety, because mental health doctors are, I think, the only ones that can prescribe anti-anxiety medications. All the doctors said I was crazy and admitted me off, and he prescribed me a simple anti-anxiety medication, and it, I would say, has been a lifesaver. It's saved my life. It gives me a little bit of quality of life back. And I know there's a lot of you out there that have no answers. I'm pretty sure doctors are telling you that you're crazy too, and I'm pretty sure your family members are tired of seeing you dying daily. So you have nothing else to lose. Please try this medication. I've also found that Klonopins work too. Anti-anxiety medication. It does affect the body a little bit. It makes you drowsy a little bit. Sometimes you get a little weeble wobbly. I think that it numbs everything out. It makes things a little bit better. Keeps your organs from doing all that bad stuff, whatever is causing it. Anyways, I hope this helped. I'm not going to get too much into it, but I've had doctors tell me I was crazy, and I'm not. It's a real thing. There are really real sufferers out there, and I hope that I can help somebody. I hope somebody is listening when I say, please try an anti-anxiety medication. If one doesn't work, try another one. There's only so many out there that you're not going to go through 40 medications. You're going to go through like maybe 5 before you find out whether or not it works for you or not. You have nothing else to lose, and you shouldn't have to suffer anymore. 12 years is long enough. A year is long enough. I know people that have suffered for 15 years, and it is so common. It is outrageous how common it is. I'm surprised there's not any awareness programs or anything on TV about it. I think that awareness needs to be brought. This is a very silent monster, a silent killer. If it doesn't kill you with the effects that it has on your body, eventually it'll make you bite the bullet, because there's no quality to life, and you will get so depressed and you will fall into such dark places that life won't be worth living anymore. Especially after 20 years of dealing with it, you just find you wake up one morning and think it's not worth it anymore to throw up constantly and live that way. So try the anti-anxiety medication before it gets any worse.